reserves. The gentleman from Colorado is recognized.
I yield myself 15 seconds just to restate what my colleague, the gentleman from Maryland, stated. If the Republicans are against the public option, if they are against the private option in the form of the exchanges, the only option left is paying more insurance premium. That's simply not acceptable to the American people. With that, Mr. Speaker, I yield 3.5 minutes to the gentleman from California, Mr. Garamendi.
The gentleman from California is recognized for 3.5 minutes.
Mr. Speaker, thank you. I guess I don't understand. I don't understand what our Republican colleagues want to accomplish here. They talk about free market. They talk about the need to provide options and opportunities. I think that's exactly what an exchange does. So I don't quite understand what this is all about. I was insurance commissioner, the elected insurance commissioner in California in 1991, and we set up an exchange. Unfortunately, Governor Wilson vetoed it. Otherwise, we'd have this exchange years ago. And a year and a half ago, the California legislature, with the signature of a Republican governor, Schwarzenegger, created an exchange based upon the Affordable Health Care Act. And actually, it was a year ago. And they want to put it into effect. The Republican proposal here on the floor would make it impossible for California to do what it wants to do, that is, set up a marketplace in which people have access to insurance. The notion being that by creating an exchange, you spread the risk over many, many different populations, so that, like a huge corporation, you have an opportunity as an individual purchaser or a small business to participate in a large pool and accept the lower rate of insurance. So what's this all about? What are you trying to accomplish here? Is it some ideology that you just simply can't stand the Affordable Health Care Act and you want to rip it apart piece by piece? Apparently so. And you just don't want to stop there. You're going after Medicare, a program that's been in effect for 42 years, that provides a universal insurance policy to anyone over 65. You're going to terminate Medicare. What's that all about? And give it to an insurance company and not have an exchange? So what's an individual going to do when they're 65 and possessing all kinds of pre-existing conditions? Go without insurance? Be at the mercy of the insurance company? And by the way, you want to repeal all of the insurance reforms, all of the protections that individuals have in the Affordable Health Care Act. This doesn't make much sense to me. I don't understand what your goal is here, except maybe to have some political scorecard. You can say, yeah, we repealed the Affordable Health Care Act. Good for us. But what effect to the population of America? No exchanges? They're gone. No opportunity for small businesses to enjoy a large market, a large pool in which they can have a lower price? They're gone. Oh, I see. You can have an association health plan. I spent 8 years of my life chasing after association health plans that were frauds. They were out-and-out frauds, sold across state lines. Is that what you want? Apparently so. I don't get it. I don't understand what the goal is here. The Affordable Health Act establishes an exchange allowing individuals and small businesses to be part of a large pool, to have 4 different options on their insurance, and you want to do away with it. I don't get it. You want to do away with clinics in schools so the kids can have access to health care. I don't understand. You cut all the money out from the community clinics so that people have to go to the emergency rooms in a more expensive situation. What's this all about? I don't understand what the goal is that our Republican colleagues have in mind. The exchanges make sense. They create a marketplace for small businesses. Thank you very much, Mr. Speaker. The exchanges create a market, gentlemen and ladies. They create a market. It is a market-driven program in which competition occurs, competition between the insurance companies who have to offer it quality and price. You got a problem with competition? Apparently so. You want to do away with the exchange. Apparently what you really want to do is to hand the entire game over to the insurance companies, removing all of the controls, removing all of the necessity for them to compete, and apparently create some sort of an association plan so that the public can be ripped off. I yield back.
Gentleman's time has expired. Members are advised to address their comments to the chair and not to each other. The gentleman from Colorado reserves. The gentleman from New York is recognized.
Mr. Speaker, I yield 1 minute to my colleague from Tennessee, Mr. Rowe.
The gentleman from Tennessee is recognized for 1 minute.
I thank the gentleman for yielding. Mr. Speaker, we in Tennessee 17, 18 years ago now tried TennCare with a sort of an exchange where we had 7 or 8 different plans competing for your business. And in 10 years, the cost tripled in our state because of the intervention of the government. Medicare, I want to speak to that very quickly. If you're 65 years of age and you have Medicare, you keep it. If you're 55 at the Ryan Plus, you keep it. If you're younger and you're more affluent senior like I have, you're going to pay more for your health insurance. Yes, you are. If you're someone like me with a higher income, you are. If you're lower income and you're sick, you're not. The federal government will act like your employer does if you have employer-based insurance. That part of the premium is paid by them. You pay your part of the premium. And again, it will be means tested for a higher income senior. Why do we think that will work? Because the only plan that I have seen this government ever pass that's come in under budget is Medicare Part D. So I think there's a real chance for this to help hold costs down. I yield back the balance of my time.
The gentleman's time has expired. The gentleman from New York reserves. The gentleman from Colorado is recognized.
I'm happy to yield 2 minutes to the gentleman from California, Mr. Garamendi.
The gentleman from California is recognized for 2 minutes.
Let's be very, very clear about this. The Republican proposal, the Republican budget proposal that is before this Congress, terminates Medicare as we have had it since 1942. For those young men and women who are not yet 55, they will never see Medicare. It's over. And instead of having Medicare, which is a guaranteed health insurance program, when they retire at the age of 65, they will be given a voucher that will be worth a percentage of what the insurance will cost. They will be thrown into the market at an age where they have pre-existing conditions, and under the Republican proposal, there are no ways in which they are going to be protected from the insurance companies, who we know have one motive, and that is profit before people. Profit before people is the way it has been for the health insurance companies from the get-go, and that's precisely what the Republicans want to give us. We will not have it. And while they're at it, they want to take those reductions in care expenditures and continue giving money to the most wealthy people in America. That I will not yield. So that the most wealthy people in America can continue to enjoy ever more wealth while the middle class enjoys ever more poverty. It is an abomination, and there is no way this nation should abandon a proven program that for 42 years has provided quality medical care to the seniors. Now, you want to go after the cost of medicine? Then let's go after the overall cost of medicine, not denying tomorrow's seniors the benefit of Medicare. It is time to understand precisely what the Republican budget does. It terminates Medicare while giving benefits to the most wealthy Americans. It should not happen. I yield back my time.
The gentleman from